Hello, my name is Judith Mendoza, and I work aiding adult individuals with ASD and ADD, ADHD, and I also aid their families and caregivers. I am a mediator, facilitator, a coach, guide, and consultant, and I help them cope and find solutions to manage these conditions and symptoms, such as anxiety and OCD, or obsessive compulsive disorder. Today, I would like to speak about the manner of understanding and processing information from those who are in the autism spectrum disorder. So how do they process information? They do this in a literal way. And they do this not because they want to or they choose to, but because that is the way that their brain receives and process the information. They are only able to process what they're visualize, hear. They are processing this information in a literal way, so they are literal thinkers. For them to interpret less factual or metaphoric and figurative speech is difficult. So there should be no shortcuts when speaking to them. Being direct to the point, mean what you really want to say, no guessing or no cueing, no non-verbal cues should be used because they will not understand them. Then also when speaking to them, they usually speak in the third person. And speaking in the third person, that can be visualized as, for example, in writing. When writing a book, the author writes in the first person to point out his views or perspective. We neurotypicals, we do that, right? We speak in the first person, which we, me and others, we, but I'm the one who's speaking. So we, I, me, myself, we all recognize as neurotypicals that is talking in the first person, and we are saying to others our points of view, just like it is in writing, when writing a book, just like how an author will express his own views and perspective. So we neurotypicals always speak in the first person. But for those who are in the autism spectrum disorder, they use alternative language, or they refer to the third person. So they use words as he or she or it or they when referring to the first person. So this can make the communication very difficult between neurotypicals and those in the autism spectrum disorder. But for us neurotypicals who are able to recognize figurative speech or less factual, metaphoric, and it is easier for us to also process information in a literal way, then understanding their manner of understanding and processing information is vital for keeping relationships and maintaining good relationships. And so that's what I wanted to talk about. And again, my name is Judith Mendoza.